Which of the following statement relating to the abnormal coagulation is the false? So which is not true regarding the following options? Which is false? So we have to find out which statement is not true. That means which is false. Here the options are the warfarin affects synthesis of factor 2, 7, 9, 10. Prothrombin time is prolonged in case of the hemophilia. Cholestatic jaundice can cause the vitamin K deficiency. Disseminated intravascular coagulation, which is the DIC, is associated with thrombocytopenia. Massive transfusion is associated with a reduced level of the factor 5 and 8. First of all, in case of the hemophilia, what occurs? In case of hemophilia, the APTT is usually prolonged. That means at activated partial thromboplastin time, it is prolonged, and there is a reduced level of the factor 8. Bleeding time is prolonged and clotting time usually normal. So in case of the hemophilia A, they affect the bleeding time, it not affect the clotting time. And the cholestatic jaundice, it prevents the absorption of the fat soluble vitamins such as the vitamin K, and this vitamin K usually responsible for the different type of the activity. And the massive transfusion, there is a chance of risk of the thrombocytopenia and also factor 8 and factor 5 deficiency, because the half-life of the factor 5 and half-life of the factor 8, they are very minimum. So in this condition, when there is a massive transfusion occurs, the 5 and 7 deficiency occurs, because the massive transfusion, almost all type of the fresh blood usually not collected, and in case of estro blood, there is less amount of the factor 5 and factor 8. Now see the heparin and warfarin. The warfarin, it affects the 2, 7, 9, 10, and in case of the heparin, it affects 2, 9, 10 and 11 clotting factor. And in case of DIC, all type of factor reduce. So it is very, very important. In case of the DIC, that means the disseminated intravascular coagulation, wall type of the clotting factor is reduced. And in case of liver disease, this is 1, 2, 5, 7, 9, 10. So this clotting factor we should remember for different type of the condition. In case of the hemophilia, the APTT increase, and in case of the von Willebrand disease, APTT increase. Why? Because the hemophilia and von Willebrand disease, actually they are responsible for clotting. So they affects at the site of the clotting time, not bleeding. It is responsible for bleeding time, not the clotting time. Also the vitamin K deficiency, it increases both APTT and PT. So which is not true? The prothrombin time is prolonged in case of the hemophilia A. This is not true, because it don't affect the prothrombin time. Warfarin affects 2, 7, 9, 10. It's true. Cholestatic jaundice can causes vitamin K deficiency. It is also true. And disseminated intravascular coagulation associated with thrombocytopenia. That means the decrease thrombocyte. It is true, because in case of the disseminated intravascular coagulation, wall type of the parameter, wall type of factor reduce, except the time, and all type of the time increases and DDR increases, and the FDP, that means fibrin degradation product, increases in case of the DIC. And all the time, such as the bleeding time, clotting time, this time also increases. But all the element, that means the clotting factor, thrombocyte, they are reduced. Massive transfusion associated with factor 5 and factor 8 deficiency, it is also true, because massive transfusion, they are required more blood. So fresh blood usually not found at a time a huge number of bags. In this time estro blood use, and in estro blood factor 5 and factor 8 amount is very less, because their half-life is very short.